I want to tell you about a man named Gerald, 72 years old, retired civil engineer, sharp mind, careful man. The kind of person who read the nutrition labels, took his medications at the same time every day, and walked 4 miles every single morning without fail. Gerald was doing everything right. And yet, at 11:47 on a Tuesday night, he was rushed into my operating room with a massive cardiac event that should never have happened to a man living the way he was living. Do you know what caused it? Not his diet, not his fitness, not his genetics. It was something he did every single evening, something his own doctor had never mentioned, something most people over 60 do without a second thought, because nobody ever told them it becomes dangerous after a certain age, and especially dangerous after a certain hour. What Gerald did every night after 7 p.m., and what most seniors are still doing right now, is quietly overloading the heart during the one window when it is most vulnerable. Stay with me, because what I'm about to share changed how I think about evening heart risk, and it might change everything for you too. I'm Dr. Soren. I'm a cardiothoracic surgeon with 28 years in the operating room. I've performed over 2,500 open heart surgeries, and a significant portion of those operations, far more than should be statistically possible, happened in the hours between midnight and 6 in the morning. That is not a coincidence. I make these videos because the conversation I'm about to have with you is the one I wish I could have with every patient before they reach my operating table. Most doctors don't have time to explain this. A 7-minute appointment almost never covers what you are about to hear. Here's what nobody tells you about the heart after 60. It is no longer operating on the same schedule it followed at 40. The body's internal clock, what scientists call the circadian rhythm, governs your heart rate, your blood pressure, your clotting factors, even how your arteries dilate and constrict. And after 60, that internal clock begins to drift. Think of it like this. Imagine a garden hose that has been in the sun for 30 years. It still carries water, but the rubber has stiffened, the walls have thickened. It no longer flexes the way it once did. And if you suddenly increase the pressure at the wrong moment, say, late at night when the system is supposed to be resting, you are asking that hose to do something it was not built to do anymore. Studies show that adults over 65 experience a 40% higher rate of cardiac events between the hours of 10 p.m. and 2 a.m. compared to younger adults. That window, the late evening into early morning, is when your heart is shifting from its active state into its recovery state. And that transition, after 60, becomes a biological vulnerability. Advice designed for a 40-year-old assumes a flexible, responsive cardiovascular system. That is not the system you are working with now. That distinction, and what to do about it, is exactly what we're covering today. Number 1, eating a large meal after 7 p.m. Here's what surprises most of my patients. They believe digestion is a passive process. Food goes in, body handles it quietly, no big deal. That is not what happens. When you eat a large meal, especially one high in sodium, fat, or refined carbohydrates, your body triggers something called postprandial hemodynamic stress. That means your digestive system demands a sudden and significant increase in blood flow. The heart has to pump harder, blood pressure rises, and your autonomic nervous system, which is already beginning its wind-down process for the night, is forced into a state of conflict. At 35, your body handles that conflict easily. At 70, you are asking a stiffened, slower responding system to manage competing demands simultaneously. A study published in the Journal of the American College of Cardiology found that adults over 65 who consumed their largest meal after 7 p.m. had a 27% higher incidence of nocturnal hypertension. That means dangerously elevated blood pressure during sleep, compared to those who ate their main meal before 5 p.m. The fix is specific. Move your largest meal to before 6 p.m. After 7 p.m., if you need to eat, limit yourself to something under 300 calories. A small bowl of warm oatmeal, a banana with almond butter, a light vegetable broth. Nothing heavy, nothing fried. Nothing with more than 400 milligrams of sodium. Your heart is beginning its recovery. Don't interrupt it. Number 2, drinking alcohol, even just 1 glass of wine. I know, this one is difficult to hear. And I'll be honest with you. Earlier in my career, I told patients that a glass of red wine in the evening was probably fine. The research on resveratrol looked promising. I believed it. I was wrong. Here's what actually happens. Alcohol is a vasodilator. It causes your blood vessels to widen. Initially, that feels relaxing. Your blood pressure drops slightly. You feel calm. But 3 to 4 hours later, which for most seniors puts you squarely between midnight and 3 a.m., there is a rebound effect. The blood vessels constrict, blood pressure spikes, heart rate becomes irregular, and your body, which should be in its deepest cardiovascular recovery, is instead managing a biochemical correction. I have seen this with my own eyes on the operating table. Patients who presented with no traditional risk factors, patients who only had one glass. The rebound effect is not dose-dependent in the way we once thought, especially after 65. Research shows that adults over 65 who consume even one standard alcoholic drink after 7 p.m. are 34% more likely to experience nocturnal arrhythmia. That means irregular heartbeat during sleep, compared to those who do not drink in the evening. The fix: if you enjoy wine or spirits, move that glass to no later than 5 p.m. and pair it with food. After 7 p.m., replace it with 250 ml of warm tart cherry juice. It contains natural melatonin and compounds that actively support overnight blood pressure regulation. Not a cocktail substitute, a genuine cardiovascular tool. Have you ever noticed that you sleep worse after an evening drink, even though it made you feel drowsy at first? Write that in the comments. I read every single one. Number 3, watching intense, high-stimulation content before bed. Let me ask you something. What are you watching at 9 p.m.? The news, a thriller, a true crime documentary, a tense sports broadcast. Here's what the standard advice gets completely wrong. People are told to wind down before bed. What nobody explains is that visual and emotional stimulation, the kind produced by high-intensity television, triggers a cortisol response. Cortisol is your stress hormone, and cortisol, released late in the evening, directly raises blood pressure and keeps your heart rate elevated for 90 minutes to 2 hours after the screen turns off. At 40, your cortisol recovery is fast. At 70, it is significantly slower. Studies show that adults over 65 take up to 2.5 times longer to clear evening cortisol compared to adults under 45. A study published in Sleep Medicine Reviews found that seniors who watched high-stimulation content after 8 p.m. had measurably elevated heart rates and systolic blood pressure, the top number, throughout the night compared to those who switched to calm, low-stimulation content by 8 p.m. The fix: by 8:30 p.m., transition to content that is genuinely calm. Nature documentaries narrated softly, light cooking shows, quiet travel content, anything without conflict, danger, or emotional escalation. Set a specific rule: nothing with a dramatic soundtrack after 8:30 p.m. Your nervous system cannot tell the difference between a fictional threat and a real one. Number 4, taking certain common medications at the wrong time. This is the one that most patients, and I have to say this carefully, most patients have never been told by any of their previous physicians. Certain medications that are routinely prescribed to seniors have a time-dependent effect on the heart. Specifically, some calcium channel blockers and certain beta blockers, drugs commonly prescribed for blood pressure and heart rhythm, have their peak effect 4 to 6 hours after ingestion. If you are taking these medications in the evening, as millions of seniors do, that peak effect may be hitting at 2 a.m. or 3 a.m., exactly when your heart is in its most vulnerable transition phase. The medical term is chronopharmacology. That means the science of how the timing of medication changes its effect on the body. This is a real, established field of research that almost never makes it into a standard appointment. A study published in Hypertension Journal, involving over 19,000 patients with a median age of 67, found that patients who took blood pressure medications at bedtime had significantly better cardiovascular outcomes than those who took the same medications in the morning, but only when the timing was discussed with their physician and adjusted based on their specific drug. The fix here requires one specific conversation with your own doctor. Not a general question, but a specific one. Doctor, given my exact medications, is there an optimal time of day for each one that would reduce my overnight cardiac load? Write that sentence down. Bring it to your next appointment. That question alone has changed outcomes for patients I've worked with. Number 5, going to bed dehydrated. Here's what nobody tells you about dehydration in the heart after 60. As we age, the body's thirst signals become less accurate. By the time you feel thirsty at 70, you are already mildly dehydrated. And mild dehydration, even just 1% below optimal fluid levels, causes the blood to thicken. Thicker blood means the heart must work harder to push it through your vessels. This is called increased blood viscosity, which simply means your blood becomes more like syrup and less like water. At night, you are not drinking. You may be sweating gently. And if you went to bed already at a deficit, your blood is thickening for 7 to 8 hours while your heart is trying to rest. Studies show that adults over 65 wake up chronically underhydrated approximately 73% of the time, according to research published in the European Journal of Clinical Nutrition. The fix is specific. At 6:30 p.m., not right before bed, which disrupts sleep, drink 350 ml of water with a small pinch of sea salt and a squeeze of half a lemon. This supports cellular hydration without causing nighttime trips to the bathroom. The sodium in sea salt helps your cells actually hold the water rather than excrete it immediately. Then keep a small 150 ml glass of water on your nightstand. If you wake, sip it. Do not wait until morning. I want to tell you about Margaret. Margaret was 74, retired school teacher, 41 years in the classroom. She walked every morning, tended her garden, watched what she ate. She had seen 3 different physicians over 2 years, and each one told her the same thing. Her readings were a little high, and she should try to reduce stress. Nobody sat with her long enough to ask what her evenings looked like. When she came to me, referred after a minor cardiac event that had frightened her terribly, I sat with Margaret for 40 minutes, not 7. 40. In that conversation, I learned that every evening at 8 p.m. she watched the news, then a crime drama. Then she ate a bowl of crackers and cheese, her comfort, around 9:30. She took her blood pressure medication at 10 p.m. because that's when she remembered it. And she went to bed slightly thirsty every single night because she'd read somewhere that drinking water before bed causes disrupted sleep. 4 habits, all of them after 7 p.m., none of them discussed by any previous physician. We adjusted her medication timing with her cardiologist. We restructured her evenings. We got her hydrated properly by 6:30. We replaced the 8 p.m. news with a gardening documentary series she came to love. 8 weeks later, Margaret's nighttime blood pressure had dropped 22 points. She went from 4 medications to 2. And 3 months after that, she sent me a photograph. Her standing in her garden with her 2 granddaughters, one on each side, all of them laughing. She wrote on the back, "The evenings changed everything." That is the whole message of this video, right there on the back of a photograph. Let me bring this together for you. 1. Stop eating large meals after 7 p.m. Move dinner earlier and keep anything after 7 light, low sodium, and under 300 calories. 2. Move alcohol, if you drink it, to before 5 p.m. After 7 p.m., the rebound effect on your heart during sleep is a genuine risk you do not need to take. 3. By 8:30 p.m., switch to calm, low stimulation content. Your nervous system needs a runway, not a runway on fire. 4. Ask your doctor one specific question about medication timing. Chronopharmacology is real, and that one conversation could matter more than a year of other adjustments. 5. Hydrate intentionally at 6:30 p.m. 350 ml of water with a pinch of sea salt and half a lemon, and keep a small glass on your nightstand. Start tonight with number 5. It takes 30 seconds. It costs nothing. And it is the single easiest way to give your heart a better night than it had last night. Your body has been working for you every single minute of your life. Give it what it needs. It will respond. If this video gave you something real, share it with someone you love. A spouse, a sibling, a friend over 60 who has never heard this. One share might be the most important thing you do today. And tell me in the comments, which of these 5 hit closest to home for you? Was it the meal timing? The medication question? The evening news habit you have had for years and never thought twice about? I genuinely want to know. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiothoracic surgeon. It is not a replacement for your personal medical care. Every person's situation is unique. Before making any changes, especially to medications or supplements, please have a full, honest conversation with your own doctor. That conversation, informed and unhurried, is exactly where good medicine begins.